Okay, welcome everybody. This is Doug McCall from the International School Health Network. Pleased to welcome you to the next Fresh Open Web Meeting, a series that we've been holding for several months now. We're using this roundtable format to, excuse me, to encourage fresh partners and others to join in these broadly based conversations. Our timeline for this session is about 60 minutes for the presentation, and then a few minutes afterwards for some of the fresh partner agenda items that are basically information sharing. It's my pleasure to welcome you to this session, which is looking at the title we've been using is Renewal and Realities. We've not got a couple of presenters as we normally do for this session because we're going to be walking through a number of documents and looking at some materials as well. So pleased to welcome everybody, and feel free to just pose questions directly by clicking on your mic or waving your hand. I should be able to see you in the video, or pressing the raise your hand question if you're familiar with that. But I'm just going to go to full screen now to begin the presentation. I hope that that's the right button. There we go. So it's a very timely session looking at renewal and realities. There's a lot going on in education, as you know, with the disruption caused by the COVID pandemic, and there is a lot of discussion about renewing education and looking at reforming education more generally. And so it's a really timely opportunity, I think, to be able to look at how we are promoting educational success, health, safety, and development. And it's that review of the materials will provide background, which is led into our global fact-finding survey and policy and curriculum analysis. I'm going to reveal my age, and Lloyd, contrary to what I said earlier, I'm not going to be dancing, but I am going to be referring to a couple of songs, well, one song and a dance that was very popular in the mid-60s. And actually, and I'm kind of worried that all this activity that is going on is hopefully going to be long-term and sustainable, and is not going to be resulting in basically, as those references refer to, a song that repeats itself, or the shake dance, which was a fad dance in the mid-1960s, which was basically a dance where you didn't need a partner and you didn't actually need to do dance steps, and you just sort of stood there waving your arms and so on. That was something I was quite good at that time when I was about 15, but it's not really productive nor very sustainable. And so that's the question I'm asking people to keep in the back of their minds. Are we really just shaking things up, or are we trying to move on? And a terrible image, I know, of me dancing, but I think it's an important, perhaps an analogy we might use. The purpose of the session is to review the recent efforts in renewing and reporting. And as I said earlier, the disruption from COVID-19 has really unfrozen education systems. There's a lot of discussion going on within organizations like UNESCO and OECD about how school systems can be reformed and how education can be changed. And so it's a really good time to be looking at what we're doing in school health promotion and development. I just worried, as we say, we end up only with the high hopes or aspirations that we've always had, or that we end up with great models and components or checklists that we try to use to persuade schools and frontline professionals to be voluntary champions and to do more about the programs and issues that we've defined and described for them. I think that's really been a challenge for us as a movement, and I think it's really important that we think about that as we continue to move forward. Reference here to churches and charities is really a reminder what the original purposes of public schools were. When societies industrialized and people moved to the cities and began work, the students, the children had to go somewhere. And so churches and charities started up public schools And their role was not just about academics and sending kids on to further studies in universities. And it wasn't really about diseases or body parts or social problems. It was to build character and to really provide care for those students in a long-term and a short-term way. And so that's really, I think, what I'm hoping as the discussions about the education systems evolve, that they're going to think about returning to those original purposes of education. The other question there in the middle of the page is, are we going to start at the bottom or are we going to start at the top? Are we going to think about what are the essential resources required, funding and time, or are we going to just think about projects and small costs? Are we thinking about working across several systems and using a systems approach and using proven management strategies used in the private sector? Or are we going to continue to focus on specific prevention programs addressing specific issues? And I guess this is where the second to last point there, do we have the facts necessary to assess the situation? And are we asking the right questions and gathering the right data? Or are we measuring what matters, or are we collecting information about what we've always done, or that is, which is politically correct or convenient? And so that's really the question. And I guess the last one is when we talk about monitoring and reporting, are we really trying to hold other people accountable? Or are we trying to help them monitor and analyze their own work so they can be empowered to improve their work in ways that are relevant, practical, strategic, and sustainable for them? So it's a really kind of a shift in approach, which I hope that our survey and document analysis will do. UNICEF and others in the FRESH partnership, we began to talk about doing a survey and a document analysis when it became clear that the Technical Cooperation Group, which is a body of about 30 countries and several international organizations and UNESCO and other UN staff that look at the monitoring of the UN goals for goal number 4, which is education. And during those discussions, which really went through 2017, 18, and 19, the TCG members deliberately excluded health and well-being from the list of indicators that they were working on. I originally thought it was because they were working towards trying to get better monitoring of student learning, and the only readily available survey of student learning was really focused on global citizenship and civics education. But it turned out that that wasn't really the case, that there was a deliberate exclusion of health and life skills education from the list. And if you go back to the official list of official indicators, and it's in the session description, you'll find that there almost every other core subject area, be it literacy, numeracy, science, mathematics, all those subjects are covered through target 4.7, but health and life skills is not. And obviously, as they finally adapted a UNESCO survey of member states, which went out in the fall of 2020, that survey does not include questions on health and life skills education. And despite the fact that in 2015, when the educational community got together and adopted the Incheon Declaration, as well as the previous one, prior to the 2030 goals, Education for All had also included health and life skills. That was not really included in their discussions when they looked at monitoring. And another ironic twist, I guess, was that UNICEF had a study done in 2007, which indicated that most countries do have a core subject, which might be called health and life skills education or something similar. And the last motivator for doing the survey and document analysis was that food and nutrition had reemerged as a key issue, and that several organizations, many of them represented around the table today, have been working on that issue, and it had emerged as it's always been a key issue, but it reemerged as a higher priority. And so we looked for information on school food and nutrition. And so that was the background to our work on this survey. As we've worked on the survey, we tried to think about what are the right questions to ask, what are the things that we need to know that are most important. And the theme that we obviously chose, which is equity inclusion, is obviously relevant to the UN goals, because that's the top line goal for goal number 4 is inclusive and equitable quality education and promoting lifelong learning opportunities for all. And the 2020 Global Education Monitoring Report has a really good set of data done through a lot of work with a lot of collection of policies and examples from countries around the world. It's a really thorough examination. They have several background reports, and they've created a database of national policies. And it really is a huge piece of work that is continuing to be a focus for UNESCO and for its partners. And so we're really pleased that we started with that in terms of our approach to this survey and fact-finding exercise. And I guess what I would say is that report really describes, and the policy database really provides a really good, thorough look at what is needed in terms of policy and the why for those policies. I'm hopeful that our survey and curriculum analysis, document analysis will help to examine the how, which is not necessarily yet covered in the work that's being done at that level. And so the points that follow there are really the kinds of things that flow from that approach to equity and inclusion. And the first is that there are many different types of interventions that are addressing the many different barriers to inclusion, or the barriers related to exclusion. And so that was our first question on our survey. Really important to understand the variety of things that need to be done and the variety of approaches and programs that have developed to respond to those different barriers. And grouping them under the theme of equity and inclusion is a really good way of keeping our focus on the whole child and on the work that needs to be done. We also looked at the determining the status of various interministry agreements, because we're working at such a broad theme of equity inclusion. Obviously, a lot of different ministries and agencies need to be involved. And so that's, again, looking at the status of those interministry agreements on children and youth in the school setting, but also outside of the school setting. The third bullet there of identifying the status of different frameworks is important, because if you're going to have a number of interventions addressing a number of factors, there needs to be some sort of, or several frameworks to guide that work. And there are several available, as you know: child-friendly schools, healthy schools, safe schools, positive behavior and intervention supports, and so on, a number of them, as well as specific programs that address school feeding, bullying, girls' education, WASH programs, and so on. So there's a number of frameworks that need to be used to address the different aspects of exclusion or promoting equity and inclusion. And then the last piece, which is really looking at the document analysis, is to examine the whole picture for each jurisdiction. How many pieces within the jurisdiction come together to promote inclusion? And that's all, obviously, in terms of the curriculum, not only health and life skills, but also the nature of the social studies curriculum. Is it inclusive? The literature and the arts that is promoted through different other subjects, the kinds of specialized programs, not only for students with disabilities, but individual education programs and so on. There's a number of different things that need to be looked at as you look at a jurisdiction. How many pieces are there to promote equity and inclusion? And that's what we're hoping we'll be able to provide some of the how that will look at the Global Education Monitoring Report. And so that's kind of the picture that led us into the fact-finding survey. Here's just an example of that first question. There are a number of interventions, and you can see them there. And this is only about half of the question, our first question on the survey, that looked at the various things that can be done to promote inclusion and equity. And the list is about double that in the question. But it's a number of things that it just gives you an example of the various things that need to be considered and need to be aligned and coordinated. And this terrible slide is really looking at one jurisdiction, and you have a reference to a document that is much more thorough from Manitoba, Canada. We looked at the different things across the totality of the education ministry policies and programs, and that's the kind of curriculum areas that looked at. And then we also looked at in Manitoba, they have Indigenous education they have a number of Indigenous students and actually schools run by Indigenous communities in the province. They have individual education programs. They have vocational education programs. There's a number of alternate pathways to graduation and so on. And it's looking at all the different things that are in place within their jurisdiction to be able to promote inclusion. And so that's the kind of looking at the big picture, if you like. Again, on the theme of the right questions, equity and inclusion depend upon addressing the needs of the whole child and offering a broad set of learning opportunities for all. And one of our partners in the FRESH Partnership, Education International and ASCD, have done some really good work on the whole child and also on promoting a broad set of learning opportunities. About 2 years ago, the FRESH partners adopted the concept of the whole child approach. And we tried to move beyond specifically looking at one aspect of human development to look at health and safety and social development, social emotional learning, and all the things that come into the development of the whole child. And that whole child approach has been well accepted by educators. So it's a good hook to be able to promote our specific agendas on that. And that whole child approach has become more and more important because of the impact of the COVID pandemic. And so as part of that, if you're looking at the whole child who should be safe, healthy, challenged, empowered, and so on, you need to look at the broad set of learning opportunities that are offered through a wide range of course subjects and through a wide range of extended education activities, such as extracurricular activities and co-curricular activities and activities available in the community and online these days. And so that's the broad set of learning opportunities. And there's been some really good work being done by Education International and other partners such as the Brookings Institute that is trying to take that concept and actually bring it into operation around the world. And the TCG, referring to the work that's being done in the UN monitoring, has gone back to it and is trying to figure out how to address those broad range of learning opportunities. And of course, our focus in terms of promoting health and development is that this core set of subjects needs to include health and life skills education. One area that's been emerging as another focus, and it's more prominently used in low resource countries, is because of the lack of resources and the focus on getting basic education in terms of literacy and numeracy and so on started, that extended education activities outside of the classroom are often used to bolster what's going on inside the classroom. And so that's been a focus for more work. And we're suggesting through the research that we looked at and preparing the survey that those activities could be better planned, better coordinated, and much more comprehensive. In many schools, there are a lot of activities offered, but not all the students participate, and not all of the activities are offering a wide range of interests. And so that kind of thinking through how extended education strategies could be better used is something that we are looking to explore within the survey and within the document analysis. Another focus for education ministries, and it's emerged quite strongly with work done by OECD and UNESCO, is that the ministries are developing statements of essential learning, or what is often called cross-curricular competency statements. And if you look at those statements around the world, and they're available through following the links from the web pages, health and personal and social development is not as strongly reflected in those statements as they should be. And so if we're going to be working within school systems that are working with these kinds of broad definitions of what they want all students to learn across the curriculum, then we need to think about trying to get those more strongly stated and better understood as part of those frameworks. As we coming back to the notion of health and life skills education, there have been some looks at curriculum by various organizations, by UNESCO and OECD. And there was OECD did a very interesting study about physical education recently, the last couple of years. It was a small study of just 16 countries. And so we need to think about how we could better understand health and life skill education and its status. And so we're hopeful that the survey and the document analysis will enable us to examine the points on this slide. We need to better understand the structure that is being used. Was it health alone? Is it life skills alone as a focus? Is it health and life skills more broadly? Is it topic-based? Is there a generic set of learning outcomes? Is health literacy used? What's the structure? How is it organized? Is an important first question. And that's one of the questions on the survey, and that's available that we can analyze through the curriculum documents themselves. There's also a number of what we've called learning behavior models in the survey, such as life skills, social emotional learning, health literacy, media literacy, indigenous perspectives, a number of them, and so they often will appear in ministry statements for all curriculum, but it's important that we see to what extent they're having an impact on the health and life skills curriculum. Some more factual basis. Some curriculum documents do define a minimum amount of instructional time or a minimum proportion of the time available to be allocated within the curriculum to health and life skills. So that's bringing that forward because that will dictate the amount of instruction that can be done in classrooms. And we've not really followed that through. The study that I'm most familiar with that looked at the issue of time was done in 1985. It's one of the first things that I came across in my work in school health promotion, where they found that 50 hours of instructional time did have an impact on health behaviors and attitudes and intentions, but we've not tracked that through. Our focus has been on much smaller chunks of the curriculum, often topic focused or based on certain problems, but we haven't been able to look at the aggregate time across the whole curriculum. And of course, going back to my earlier point, whether or not there's a comprehensive and coordinated strategy for education, extended education, and then going into teacher preparation, if there are requirements for health and life skills education, both among elementary school teachers, generalists, or at the secondary level for specialists in teacher education. So those are the kinds of questions that can bring together a more coherent look at what the status of health and life skills education actually is. And we hope that will emerge from our work moving forward. This set of questions is relatively new. They're captured in the fresh document we created in 2019 called Cross-Cutting Themes. Those cross-cutting themes in the original version in 2014 had looked at parent participation and student empowerment and community ownership. We broadened it out to look at the issues illustrated on the slide that looked at whether or not these kinds of things are covered in the monitoring and indicators that are being tracked. And of course, one of the first one is whether or not the context has been truly considered when designing programs for a particular country or state or province. And so we're trying to be practical in terms of the questions we're asking or the determinations we're trying to make. And so something practical that is now actually included in many UN agency documents is whether or not a situation analysis tool, a context assessment tool, was used in identifying the needs of that situation, and whether the jurisdiction had identified a limited number of priorities each year. So that's the kind of fact-based finding we're hoping to be able to report out. A second characteristic, perhaps, that is moving beyond asking the simple question is whether if there is a framework being used, such as child-friendly schools or health-promoting schools, whether the jurisdiction has adopted a statement or a declaration supporting those, to moving beyond that to say, is there a policy that has certain requirements, resources allocated, and so on, whether there's an action plan with some start dates and end dates on it, whether there's alignment between the various approaches, child-friendly schools, healthy schools, safe schools, community schools, and so on, or whether they're all operating in competition or crossing over with each other, and similarly with the multi-intervention programs such as food and nutrition, mental health, HIV/AIDS, and so on. Have we looked at how those are being aligned? And it's interesting, the recent survey done by the Schools for Health in Europe, they made a strong distinction in their work as to whether or not people were simply implementing a good list of interventions, but they weren't coordinated. And so they made a distinction between having a policy framework as opposed to simply adding more and more interventions within the school setting. And so that's kind of, we're trying to figure out whether or not we've moved beyond that aspirational kind of material that we've been working with for the last couple of decades, and whether we're actually getting down to adopting action plans and so on. Another area that we're trying to explore throughout the project is whether or not the responsibility is shared across several ministries, or whether it's really implicitly being pushed onto the agenda of the education ministry and the local educational authorities. And so asking specific questions about different ministries and what kinds of roles that they've been assigned and what kinds of resources they're bringing to the table is important. IMSS is a phrase we've used within that fresh document, which is implementing, maintaining, scaling up, and sustaining. And the research in that area has been expanding quite rapidly over the last while. The good work out of Australia by the implementation center down there and others within North America enables us to ask quite practical questions as to whether or not the situation assessment tools are being used, whether the work is being guided by a published and evidence-based implementation framework, whether cost estimates have been used to predict both startup and ongoing costs prior to launching a program, whether there are coalitions supportive of the work are in place, whether there's been adequate stakeholder involvement, and whether specific barriers are being addressed in the work. And so that's the kind of questions that, again, looking at the right kind of questions that we're hoping to ask. Capacities, there's been a lot of work, as you know, in that area, both ministry capacity and agency capacity. So things such as coordinators, interministry committees, whether there's a real plan for monitoring, reporting, evaluating, and improving, whether there's a process to do that, whether there's a workforce development plan, and whether educators and other professionals are being adequately prepared as they come into schools to work in schools. The integration within education theme is another one that's emerging in the conversations about our next steps in school health promotion and development. And so we've asked some questions around that, whether the partnerships are general partnerships with broad goals, or whether they have annual and strategic activities identified, because that's the kind of thing that always motivates a partnership to be active and alive and well funded. Whether those partnerships are negotiated transparently, whether there's frontline staffing assigned by all of the different ministries, whether there's been some really good sharing of the profiles, both in terms of the high-level ministers and senior officials in the activities, whether the benefits to education are always clearly stated, and whether educator concerns are being addressed. And so those are the kinds of issues within that theme that need to be thought about in terms of asking the right questions. And then this is a very new area, but it's something that we need to think about as we move forward. The ecological approaches are now well accepted. We've gone from settings-based work to looking at the multiple ecological concentric circles that many models describe. But we need to think about how one works within that in terms of the public systems, education system, health system, agricultural system, and so on, whether or not we're learning how to work those systems properly. And looking at the role of middle management, looking at annual budget lines, looking at explicit decisions to move towards a systems-focused action model, systems-focused change model, and so on. It's a new area, but whether or not there's been a conscious choice made within the jurisdiction to be able to move in that direction. And then, so that's sort of gets a picture of what we're trying to do with the project, trying to go from our traditional sort of aspirational ideas to more really harder questions and more systematic questions. This is beginning to look at, this slide's beginning to look at the number of activities that have been underway, and it's really quite encouraging. There's several groups that have been producing new or revised self-assessment tools. There's been, the World Bank has been upgrading their SABRE system, the School Health and Feeding Program survey component that they have. There's been the WHO Global School Health Policy and Program Survey has been updated and is now available not as a going to all schools, but as a random sampling tool. In Europe, there's really good work that's been done by the Schools for Health in Europe. They have a rapid assessment tool and have an excellent guidebook. And FRESH as well has identified various themes that we've been looking at updating as we move forward. Now, self-assessment tools are useful if jurisdictions have the capacity and the political willingness to self-assess, but the availability of good tools is really, it's encouraging to see that, and this is just a short list of many that are being revised or updated or published for the first time. So it's encouraging to see the resources that are available once a jurisdiction is ready to think about what they're doing and how they can improve it. There have also been a number of updates, in other words, reports on different themes and topics and approaches, both at the global and regional level. And there's also some recent policy and program surveys that are being done. And these are just a few in the slides, which will be online, or in the materials that in the session description. There's a really good study being done by in Latin America on school health promotion. And of course, the recent survey that's been done by the Schools for Health in Europe. Those are really good reports, and they really give a good regional look at the status of school health programs in those two areas of the world. A lot of good work on school food and nutrition. There's a global update from the World Food Program that provides a really good comprehensive collection of the different initiatives, and they're moving quickly and they're moving strong as those organizations concerned with food and nutrition are working together really effectively. And then there is also a recent survey on school feeding, which is comprehensive, done by there's a nutrition foundation that's done that. And then of course, WHO has done some really excellent work on nutrition policies. Sorry, if you could just, if you need to talk to people outside of the meeting, if you could just click on your mic to make sure it's off, that would be great. So, and the WHO report, it was a 2016-17 data collection that the recent report, or the report that came out a couple of years ago, but I understand they're going back into doing it again, so that will provide a great look at school nutrition policies as part of a broader.
Management se khali madam ki speech hai na.
I'm just gonna, Dr. Mehta, if that's you with your mic on, if you could just make sure it's off. Thanks. Another area that has been doing some good work in WHO is in 2018, they added a couple of school health questions to their survey on maternal, child, and adolescent health. So I'm just going
President
to
जब
just
बोलता है
take a moment to
आप खाली एक बढ़िया सा बना लो स्पीच. हाँ.
there. Hopefully that will. Hopefully the Dr. Mesa's mic has been muted. So the WHO survey on maternal and child and adolescent health now has two questions. One on whether or not there is a policy on health promoting schools and whether or not there is a monitoring process in place. And so that's recently, well, added in 2018, and their survey results are now published. And I believe there will be some national examples in there in a policy database on that question. And then the new UN interagency group on school health and nutrition has started a comprehensive synthesis of the existing reports, and that report will be out probably in the fall. And it's part of a broader plan to be able to monitor what's going on in that area. Sorry to jump around. I've already referred to the OECD analysis, which is a really good look at physical education curriculum. There are a number of regional and national reports on child-friendly schools and health promoting schools and safe schools. And so it's a really good, very busy picture of more work being done, and it's great to see. I do want to have one more cautious note, and for those of you who are familiar with the work that's being done by the CDC in the USA, they had a school health policy and program survey that they had in place for a number of years. It was an excellent comprehensive survey, both at the state level and into the school districts and into the schools. It gradually suffered from budget cutbacks so that they had to break up the data collection into smaller chunks. And the last survey was done in 2016. The last piece of that was done in 2016. I'm hoping with the change in government and with the renewed interest, that really comprehensive tool will come back into play as a model that we can all work towards. I know that in our work in Canada in 1999 and 2000 and so on, we used that survey as a model for our work, and I hope it can be again available as a model internationally. Here is just a very, again, looking at some really good things going on. There are a number of organizations and researchers who are now reflecting on their work over the last couple of decades and looking at renewed frameworks in school health and development. Albert Lee has provided an excellent update in an article on the award accreditation system, which is used by many countries. That's the system that is used to monitor progress by having schools that are either gold, silver, and bronze sort of designations, but there is a mandatory accreditation system that is used, and Albert's provided a great update on that. There's a lot of good work being done on what might be called transferable life skills or life skills. UNICEF, WHO, UNESCO, and even a great new global social and emotional learning alliance that has some really excellent work being done in that area. And then I've already referred to the work that's being done on whole child approach, and that's going to be very relevant to the education reform discussions moving forward. And then some really good examples of systems thinking in some of the materials that are produced by UNODC and UNESCO and FAO and so on. There are a number of documents now really incorporating systems thinking into their guidance documents. And more recently, just last week, I think it was, where WHO released their long-awaited standards on school health promotion, and they were excellent in adding their standards on school health services, so that those standards are going to be really good guidance for countries moving forward. And there are also some really good comprehensive strategies from UN agencies, the the World Food Program and the FAO program policies on approaches on school food and nutrition are really comprehensive and excellent material to work from. And then there are some really good discussions going on in the academic world in terms of progress in school health promotion. There was an excellent article in the Lancet at the global level, and there's similar articles going on in the US. Taiwan has renewed their health promoting schools program and has got a really good academic component. Ireland has published some really good recent materials in the last year or so. And so there's a lot of things going on, which are all indicative of really good interest and stronger interest. And this is reflective of some of the kinds of things that are being thought about and worked on. Some really good work out of the context of education in emergency contexts, where they're working on psychosocial environments and support. And there's really good work in high resource countries on integrating or coordinating student services, wraparound services kind of approach. So I'm going to stop here and ask for comments and additions to my very quick run through of all the shaking that's been going on. And then maybe come back to look at a little bit more about the fact-finding surveys. So asking for questions or comments or additional information that we can follow up and post in the fresh web pages. I just need to be able to look for, there's one question, there we go, from Melissa, who's identified some other materials from FAO. It's in the chat box. So that's great. Thank you, Melissa. But please just jump in, click on your mic, and I think we're a small enough group to be able to answer questions or share information. Excuse me.
Well, Doug, this is Erin. I'll just jump in really quickly. I just first want to say, wow, this has been excellent and really setting the stage of what's going on and what you have found so far. I wanted to particularly, it's more a comment, not a question, but particularly highlight what you started with in looking at how different groups are, this whole idea because of what COVID has done, it's shaken things up. And how do we build upon this, I feel, a window of opportunity of trying to really integrate school health, like from a more long-term sustainability range versus, oh, now we have an opioid crisis, so let's have this program, or we have this crisis, so now we're going to do this, but that more long-term, like theoretical base, I think that's critical, and is something that, at least on my end, I've noticed has really been missing in the past, but I think is a great opportunity. So that's my comment. With that, I guess, is a question is, do you know of any countries or areas that are doing that well that we could learn from? Or do you feel, how would we move that kind of forward? Because it's very different from the mindset of crisis management, which I think oftentimes happens in school health. You're muted, Doug.
Yeah, just to respond to that generally, and I think we have a real need to link into the conversations going on in the education sector about education reform after COVID, because it's really been a real significant disruption in the education system. And so there's the Futures of Education dialogue that's being sponsored by UNESCO, and the OECD has one, and the WISE Forum, which is sponsored by Qatar. There's really good global conversations going on in the education sector about education. And if we can come in with a strong education relevant argument about why the social role of schools, and more specifically health promotion and social development, can be a stronger component in that, then we will create more space for our work within the school systems. But we need to get our act together and not just simply say, well, you need to do all these different programs, but we need to think about, from the perspective of educators, how we fit into their context. And that's the challenge. We are going to be in the late summer asking educator groups, teachers, school administrators, deans of education, to develop a position paper on education reform. And then we hopefully within the health promotion and social development sector, we can add on to that as to what what we offer to help reform schools. And that will be the end of August and in time for what will be a global conversation about education reform in the educational community at the global level in the fall.
Wonderful, thank you.
Further questions or comments, please jump in. I'm sure that quick run through of all the shaking going on is you can follow the links in the session description but add your own, please, or your own observations about, are those the trend lines? Are those is that the challenge? Is the challenge about the right kinds of questions? Is that fair in terms of, is that a fair characterization of what I've called our aspirations versus the realities? Okay.
Well, the amount, just brief, the amount of surveys. Hi, this is Bella.
Yeah.
Bella Monza from GZ. The amount of surveys is amazing. What's all there? The knowledge, I think it's so much is there, and it's good to compile that and see not to further. I think there's also quite some duplication, but also to see not to further duplicate. But it's so at the moment, I'm so annoyed with the whole situation of still school closure in Southeast Asia. So we're running a program in 4 countries, and in all 4 countries, the schools are closed. It looks at the moment as if the Philippines would close for another complete year. That's what they announced. I mean, just to imagine that they closed since March last year, and they think closing another year. I'm thinking really of doing schools in the future just in front of computers, which is far away from our perspective what school's supposed to be. So it's it's such a difficult situation at the moment, working close with governments and also seeing the difficulties they're all struggling with, and closing the schools. So that's, I mean, this is a bit out of what you've presented here. It's a different topic, but I just, I see Leslie's hand is up, and
well, no, I'd like to jump in a bit, because there is a real disconnect. If you read through the materials on the Futures of Education Commission that was established by UNESCO, they had this conversation going on in education that is really disconnected from the reality of the COVID crisis. I mean, if there's ever a time when WASH programs in particular, but health education and hygiene and vaccinations and vaccine literacy, I mean, all those things are relevant, and it's just not appearing on the radar screen of those. If you read through the background materials for that Futures of Education Commission, it's just not penetrated that world at all. And if there's any time when health education is more important, surely the COVID crisis has underlined that. But it's just, there's a real disconnect. It's kind of discouraging, and that's the challenge, as I indicated earlier. Leslie, do you want to please jump in?
Leslie, you muted.
I think that's a new thing, isn't it, Bella? You're muted in this world of COVID.
Oh my Lord, yes. My goodness. Yes.
It's great to see all of your names again. So it's great, Doug, for organising this call. One of the things that I've just been reflecting on is it's great to hear from Bella from the Asian perspective, but my work is really focused on Africa and getting the kids back into school, what they've been doing, how they're going to get kids back. The schools are kind of opening, but not really. And some of the options that they're taking there. And I'll give you an example, which is in Nigeria. It is the most populous country in sub-Saharan Africa, as you know, and all of the schools closed. All of the kids were. The early marriages went up. The boys went into jobs. All of the rest of it. And what really pulled it back a little bit and is starting to really have traction is the school feeding. And so even though the schools were closed, we tried to keep the school feeding open. And so the teachers, for example, were even still, and the cooks were still cooking the food and taking the food to the extreme of taking it to the houses of the children and making sure that the girls got their lesson plans at the same time as they got their food. And so please don't marry them off. The schools will be open. And so the Nigerian government are really looking to find ways outside the box to keep the kids, one, engaged with their school lesson plans, and two, to come back to schools when it's safe enough. And you know, we're writing a paper about that at the moment, and I'd like to share with the group a document that we're writing. It's really in draft, so excuse all of the draftness of it, but I really appreciate your thoughts on this and how I've tried to look at the core of fresh in it and say, this is why we're doing this. This is why the school health really matters. This is how we keep the kids in school, not just the girls, but the boys as well, because the boys are taking the jobs and we don't want them to do that. And I'd really appreciate your wisdom on how we can, on your thoughts on how we can strengthen that paper, because I think countries are struggling and different countries can learn from each other, and this is what this group's about. So I'd really like to share that. Thank you.
For sure, we'll pass that along to the Fresh network, and we have a broader network that we send these notices out to about 2,000 people. Well, Leslie, you'll have your own list, but if you wanted within the Fresh partners, I'd be happy to pass that along. I see for a comment from Igul, sorry for my pronunciation, talking about the experience in Europe with WHO in Europe, and Igul, if you want to just add to the point you made in the chat box, it would be great to if you wanted to click on your mic and add any more information about that comment. If I see that you've got to leave.
Yeah,
okay.
I will just, sorry, I have also to leave in 2 minutes. Just want to say, I feel that the point Leslie made is absolutely right. What will bring kids back to school in low-income countries is food, which will bring them back. That's really the point. I cannot agree more to that. And we once did a little survey, just so if you start feeding every day, not selected day, not only few kids, to all children, the daily attendance is immediately high up. Yeah, so food brings kids to school, and that's also something that could be learned from the Indian school feeding program. I think it's 25 years back, and India feeds all children every day. So I think it's a different story from what is on the agenda here today, but I think looking into that direction is absolutely right. And thanks for making that comment. School feeding will become of high importance with point to bring kids back to school. Yes, I cannot agree more. Yeah.
You know, I actually, and thank you, Bella, for the comment, and for Leslie, that's something that's underlying the value of school health and development programs, is that that's why churches and charities created school systems. And that's the service that, and we somehow have spent a lot of time trying to persuade educators that, healthy kids learn better and, they're going to go on to university and whatnot, because that's the narrowed focus of school systems. For many school systems has been that academic orientation. And we need to be able to defend, no, these services that can be provided best through schools are absolutely fundamental. And it's to the community, and also in terms of COVID, the ability of parents to go to work when their children are not able to go to school is diminished. And so we've got to be able to make that argument within the educational community about that. And school feeding and basic hygiene and safety are the things that are the basics. That's the custodial function of schools, which we often overlook as being primary for parents in terms of considerations. But anyway, thank you, Bella, and we'll talk to you soon.
Thanks, and sorry I have to leave, and wish you a fruitful meeting.
Okay, great. Further comments or questions? I'm going to just, I think rather than spending too much time on the actual survey, you have a copy of the survey, the link to it, we're now field testing that survey, and you have two other documents: the search strategy we're using, and then also an example of what we eventually hope to have in terms of a document profile for each jurisdiction. Those are really big long-term projects that we're going to be hopefully able to accomplish over the next several months. But if you have any comments on those, please jump in with please send them to me directly. My email address is in the session description as well. This slide we're seeing now is really just some of the details. I think I've covered most of that in terms of the kinds of questions we've asked, and so on. And then also I'm going to just go to the next slide, which is the policy and guidance and curriculum analysis. Those are the two documents, and so on, and the next steps for that. We are looking for what we've called, we'll obviously be looking for respondents, and they will be from the ministries of education. So we'll be looking for people to identify people within the education ministry who are best able to answer these kinds of questions. And I realize that's going to be a challenge for getting someone who may have to go to others within the ministry to be able to respond to some of the questions. But we are looking to have the questions answered by the education ministry official. Not on behalf of the ministry, but in terms of what they know about their own ministry. And then we're also looking for correspondents, what we're calling correspondents and analysts, who will help us both in terms of identifying the materials within their jurisdiction, and then also being able to help us analyze in terms of either the country-based profile or the state provincial profile, or in analyzing the results of several jurisdictions, grouping them together either by country, because we are looking at subnational jurisdictions, or looking at different regions of the world. So we're looking for people interested in doing the analysis once we have the data from the survey and the documents. And so, and that work will be done through the auspices of the Fresh Working Group on health literacy, life skills, and social inclusion, and also a parallel group sponsored by the World Education Research Association, which is the most senior research community within the education sector. And so that's a chance for them to get this kind of discussion going on within that community, the World Education Research Association. The documents themselves will be stored in the UNESCO Resource Center, and it will be available as well. So further questions or comments before we look at a couple of business items for the Fresh Partners? Lloyd, you wanted to jump in. I see you had a question in the chat box that I didn't get back to.
Oh, not a problem. Just a quick comment to say there was just a superb seminar, Doug. Thanks for doing that. Will your hyperlink slides be available so that we can study them after this?
Yes, they're already within the session description, but I'll do maybe a bit of a broader list for people to look at, and I'll post it aside as part of the session description on the webinar recordings page of the Fresh website.
Terrific. They're just superb. It's very helpful. My only other comment is, as you're working with Fresh on this, which seems like it's going to be very much a benchmark effort, will you be trying to figure out how to winnow it down so that there aren't too many questions and they're really essential questions? And I know it'll be difficult because each country is different, each circumstance is different. People have different foci within school health programs, but as you're thinking through that, look forward to kind of understanding how you do winnow down from a larger number to a smaller number. I think it would help us all.
Yeah, that's been a challenge. We started out with the idea we would have 50 questions, and we're close to that number, but we've cheated because we have a lot of questions with subparts to them. So that's not really it. But we are hoping that our respondents and our correspondents will see this as a value to themselves, and not just answering a survey, but actually will provide data in their own work. So and the respondents and the correspondents will all get we're starting up our information service again, and that will be a reward, an annual subscription to a really comprehensive service as a reward for as a compensation or a token of our appreciation for their time spent on this exercise. Because it is going to take some time to gather the answers to the right questions, as I've tried to indicate. There are, and also hopefully this session has provided a broad view of what's already being done. We took a lot of questions out about school feeding because there was a recent school feeding questionnaire, a survey that was, that does a really thorough job. So we need not ask questions about that. So we're trying to make sure that we don't ask questions that have already been asked recently. There is another alignment effort we're going to try to make in terms of the storing of the documents. They will be stored on the UNESCO Health Education Resource Center website. But I understand that there's been some changes there, so the people we're working with in that team are actually responsible for collecting other documents around UNESCO initiatives. And so hopefully there will be some alignment done internally within UNESCO that will also provide more efficiency and so on. And we're actually hoping maybe to find them some few dollars to be able to do that properly. And last point, which is that this is not I'm hoping this is not going to be a one-time exercise, but that we'll be working towards more of a knowledge-driven approach to our work. And our session in early September, which will be led by our colleagues from Parvis, from UNESCO, is looking at how we can use these kinds of reports and data to build to work towards improvement, how this can be fed into improvement strategies within countries, to build capacity within countries to use this kind of data. And I'm hoping that eventually the kinds of questions and the kinds of documents we're gathering here will be taken up by a long-term process that can really build on this, because that's the value is comparisons and contrasts over time that make the most sense. That was the value of the SHIP study done in the US for so many years, and I'm hoping that we can establish something at the global level for that. And
that's very helpful. Thank you.
Okay, I'm just going to check the chat box to see if there's any other questions or comments from Yang Ping.
So
Yes.
this is
Sure, go ahead,
Leslie,
Leslie.
and Yeah, sorry, I'm having some technology problems here and I can't get into the chat box, so sorry for interrupting. But just to let you know that I'm working with Parvis and the UNESCO team on improving the Saber survey, which is the survey system that you all know about, and we're looking at integrating the school health with the school feeding and making it healthy Saber. And that we've got 55 assessments so far from 55 countries. And I'm very interested, Doug, in your thoughts about where to house this, because this is a key question coming up. Where do we house this? Do we house this in UNESCO? Do we house it in the World Bank? Where? Because the countries are coming back to us with all of this information, all of this survey information, which is very comprehensive. And I'm in the midst of that analysis at the moment. And I value the opinions of this group as to, should we push for somewhere, to house it in the World Bank, or maybe UNESCO should house it. It's not just about health; it's about the education piece and school health as a subsector. So, just to let you know, I'm doing that, and I'll value your opinions, and I'll send you what I'm doing, but not to share it beyond the group. But it's just where to house it. How do countries, which is the feedback I'm getting from countries, where can they access what other people are doing? Over.
Okay, that's a good question. Maybe that's something that we could address in the next session in early September, because my short answer to websites is they're cheap. You can have something on 2 websites and mirror it, and that's the technical solution is easy, but it's more getting people to look at the shared information. It's the process of getting not only the decision makers, but the data gatherers and the data and data analysis to work together. So maybe that's something the UNESCO and the World Bank could think about more broadly, and then also be able to build it into a data sharing strategy, so that when work that the kind of work that you're doing is shared widely and easily and conveniently. And I think that's part of the conversation. And so that, and then looking at it from a country perspective, how do we help countries to know that that kind of work that you've just done is readily available, and where do they, if they like to go to the UNESCO website, that's great. If they'd like to go to the World Bank website, that's great. So that people know where to find it easily. And it's part of a kind of a community of practice around data sharing and data-driven decision making. And so that's the big picture. I do have a question from Yongfing from UNESCO. Just the time frame of the survey. We will be we'll be doing the survey in the early fall, with hopefully preliminary findings by late November, and then we'll be sharing those preliminary findings, and then the reports themselves will be, we're going to have one global report, straight tabulation of the responses, and then 4 breakouts: low resource, high resource, middle resource, and conflict affected countries. And that's really just going to be the tabulated data. Eventually, the data itself will be available. We just have to figure out how to do that technically. But that will be all available in hopefully by Christmas. We'll have a really good package to be able to share with people. Further questions or comments? If not, I'd like to just move very briefly to our agenda. Oops. And look at, I'm just going to skim quickly for our fresh partners. I think we can, this is all information, but pleased to say that Save the Children is going to be doing, is restarting the fresh webinars in the fall. As you know, Sung Lee has retired, and her colleagues are picking that up in the fall, so that's great. We will be going back to the technical cooperation group about our concerns about 4.7.1. Item 4C we've just covered. For D is we've referred to in this, and 4F, as you may recall, we started up a work group on inclusion. It's really a follow-up to the Global Education Monitoring Report. And a number of organizations who have been working on that have agreed to do a series of webinars in the fall, web meetings. So watch for that in the fall. And then I've referred to 4G, the paper and discussion on the futures of education. Normally, we do have a report under 4E, the UN interagency group, but unfortunately, Emily is not able to attend the meeting today, but we'll see that at our next meeting, an update there. Is there any further questions or comments on the business items from the FRESH group? Or can we think about closing up the session? Okay, I'm not seeing any questions, so I'm going to stop sharing and just look to wherever the button is for stopping the recording. There it is.